Welcome to the Private Practice Survival Guide podcast with your host, Brandon Seigel. I'm a published author, speaker, entrepreneur, and private practice strategist dedicated to transforming the way that healthcare functions. This podcast is all about empowering you to create the change you want to see. Let's dive in. Thank you for tuning in to this quick tip episode of the Private Practice Survival Guide podcast. Today, we're talking about breaking down your budget metrics. And I think it's really important that we just look at this in its own kind of cylinder, so to speak, its own little playground, sandbox, as I like to call it. So today, we're going to really just focus in on the way that we measure our budget through metrics and some of the different things. So here's some tips to breaking down your budget metrics to start. First is I want you to segment revenue by source. So important. Break down your total revenue into specific categories. So a lot of you look at just the payer, whether it's Blue Cross or Kaiser or whatever, but I actually want you to go to another level. I want you to have client fees, insurance category, reimbursement by payer, what type of services are being paid for, evals, treatment, all those different things. I want you to track each source's contribution to the total income to identify high-performing and underperforming streams. So an example would be a medical practice might find that telehealth visits generate 20% of the revenue, prompting increased investment in virtual platforms. Now, as you've heard from other episodes, I have some concerns where telehealth is going in certain sectors of healthcare. Some sectors it will grow, some it won't. But I still believe in it. I still desire it. But understanding that segment is important. So I had a client that had 75% of their revenue was tied to telehealth. And we saw that they were heavily Medicaid, and Medicaid was changing its funding model. So we had to pivot. So sometimes that's really helpful in the budget metrics is defining how dependent you are in that. What is the actual percentage of patient payment versus insurance payment? Because here's another thing. If right now patient payments make up less than 10% of your revenue and you decide to go out of network, that patient responsibility is going to go up. And that could be a deal breaker for you because you may not have the patients that are willing to increase their pay structure to your practice. So we want to segment your revenue by source. The next is we want to categorize expenses into fixed, variable, and capital. Divide expenses into fixed, rent, salaries, etc. Variable, supplies, utilities, capital, equipment purchased. Calculate each category's percentage of total expenses to pinpoint your areas for cost control. An example would be if variable costs exceed 40% of the budget, maybe we negotiate certain contracts to reduce that variable. We have to decide if we like variable or if we like fixed. There's benefits to both. The benefits of fixed expense is that the more revenue you bring on top of that fixed expense, the more margin you gain back. The benefit of variable, depending on how that variable is calculated, sometimes variable expense can correlate with revenue, so you're taking on less risk. So you got to look at all those pieces to it. The third thing I want you to look at breaking down your budget is I want you to calculate your key performance indicators. I want you to compute essential KPIs like profit margin, net income, revenue, overhead ratio, accounts receivable turnover, all those things. I want you to monitor these metrics to assess the financial health and compare against industry benchmarks. Let's see what our industry says is working. Let's utilize resources like MGMA, Medical Group Management Association, that can give you some benchmarking potential. Example, a low receivables turnover may indicate delayed payments, prompting stricter billing guidelines. 4, I want you to analyze the cost per service and analyze cost per patient. So I may average a certain cost per patient. I may average a certain cost per service. Determine the cost of delivering each service or servicing each client by allocating direct staff time and indirect facility expenses. Use the metric to identify unprofitable services or clients and adjust pricing or resource allocation. So an example, a therapy practice might discover that group sessions are less profitable, leading to a focus on individual appointments, just as an example. 5, I want you to track cash flow metrics. Break down cash flow into inflows, payments received, and outflows, vendor payments, payroll. Money in versus money out. Where are we gaining money, losing money, and what is the frequency of loss compared to gain? Every month, if you had a bucket, are you putting more in the bucket than's falling out of the bucket? What is the percentage of increase above that threshold? Monitoring net cash flow and days cash on hand to ensure liquidity is crucial for your operation needs. You got to do it. So if cash flow dips seasonally, we need a plan for a reserve fund to cover lean months. For the past 20 years, I've had the privilege of helping pediatric occupational, physical, and speech therapists redefine the way that their business functions and helping them tap into their entrepreneurial spirit. In recent years, I recognized a deficit, which was bringing private practice owners together with the vision of allowing them to connect, learn, and grow. And Growth Code Conference was born. From sunrise to sunset, we offer an opportunity for pediatric, occupational, physical, speech therapy private practice leaders and owners to connect, collaborate, learn, grow from yoga to breakfast to lunch to coffee carts and more. We take you to another world where you are inspired, where you feel empowered, and where you are able to grow to the next level so that we all can change the world one child at a time. The other thing I like to do is I like to use visual dashboards for trend analysis. Creating visual dashboards, whether it's Excel, QuickBooks, Monday, Tableau, whatever that is, I want you to display those revenue trends. I want you to display those expense growth, KPI changes over time. I want you to identify all the patterns, such as seasonal revenue spikes or rises, supplying to inform budget adjustments, because we got to understand those budget adjustments. Now, a dashboard showing a steady increase in utility costs might prompt energy saving measures. Sometimes we can look at the way that we're doing in spending money, because maybe it does make sense to change certain resources in order to save or to be able to have a better output. So I'll give you an example. Let's say that you are outsourcing all your laundry for bedding for your tables and whatnot. Maybe it makes more sense for you to bring that in-house. Maybe it doesn't, but looking at the efficiency of that, what the value of those sheets are, sustainability, etc., all things that we can monitor in that. Number 7, I want you to review metrics in context of goals. I want you to align budget metrics with practice goals, such as increasing patient volume, reducing overhead. What is that tipping point for your practice? At what point do you become non-sustainable, non-viable versus viable? Evaluate whether current metrics support these objectives or require strategic changes. Do we need to reallocate certain funds to boost client acquisition? So if a goal is to grow revenue by 10%, but client retention metrics are declining, maybe we need to invest in loyalty programs. These are all really important. So here are some metrics that matter in your budget. So we're going to measure our revenue by source. Why do we measure it? Because we identify which streams drive profitability and highlights underperforming. So what it measures, it's measuring total income broken down by source. The example, a dental practice find that cosmetic procedures generate more revenue. Track it monthly to adjust service offerings. We want to measure our profit margin. That is our net income, revenue minus expenses divided by total revenue, expressed as a percentage. Now, recognizing there's 2 types of profit margin. There's accrual-based profit margin, which is the value we anticipate of the service versus the actual expense. And then there's a cash basis, which is money in versus money out. How much do we profit at the end of the day? This indicates your overall financial health. This is important to the efficiency. So a 15% profit margin may be below industry standards, but it's signaling a need to reduce costs or increase revenue. How to use, compare it to industry benchmarks. I'm saying, so in my opinion, if you don't have 15%, it's pretty hard to survive in today's market. I've seen as low as, averaging industry in the 12.6%, all the way to, there are some industries where if you're not at 25%, you're below market standard. So understanding those markets is really important. We need to assess our overhead ratio. We need to look at what we're measuring. So we're measuring overhead costs, rents, utilities, administrative salaries as a percentage of the total revenue. What is the overhead that we hold on a regular basis? Why does it matter? It reveals how much revenue is consumed by non-service related expenses. We need to look at the actual facility expense, the total people expense, and how to measure ratio to our industry standard to get back that meat on the bone, as I like to call it. When we're looking at our budget, we also got to look at that receivable turnover. So that's annual revenue divided by average accounts receivable, showing how quickly we collect our payments. Reflect billing efficiency and cash flow. So I always find when we take over an account, our cash flow is a huge measuring component of what is the cash flow increase in the first 45 days of performance, because that's going to measure the initial improvement. And then you'll see overall what's the speed of collections. And so those are two budget KPIs we want our clients to really look at. The next thing is cost per service client. And we talked about this, but this is whether it's direct or indirect, it's important. And so that's going to allow us to measure the value versus the expense. And as we're looking at all these things, we also want to look at days of cash on hand. What are the number of days the practice can operate utilizing available cash? So what's that runway? 30 days of cash on hand may be risky. I always say 6 months, you may go off of 90 days, but what is your cash on hand? Now, a lot of you have a line of credits, and that's great, but ideally you don't have to pull from a line of credit. So I'd like you to have 6 months plus a line of credit. Did you know that in 2024, Intuit QuickBooks reported that private practices breaking down budget metrics monthly improved cash flow by 17%. That reduced financial stress for 60% of owners. So Bobby Unser, the champion race car driver, said this, and I love this quote. Success is where preparation and opportunity meet. Thank you for tuning into this episode of our Quick Tip Private Practice Survival Guide podcast. Please like us, subscribe, stream us anywhere you listen and watch your podcasts, and together we can thrive, not just survive. Thank you for tuning in to the Private Practice Survival Guide podcast. I'm incredibly grateful to each and every one of you. Exciting news. We're now available everywhere, from Spotify to Apple Podcasts to YouTube or anywhere you like to listen to your podcasts. So watch, listen, and reach out. If you love this episode, please drop a 5-star review. It truly means the world to me. Are you looking for more ways to elevate your practice? If so, now is your chance. Reach out, go to my website, or email me at brandon@wellnessworksmp.com. And remember, it's not just about surviving, it's about thriving.